everyone, this is Anna from nursestudy.net, and as per your request, we will be doing longer NCLEX practice questions starting with the medical surgical. I will be doing series of 25, 50s, and 100s just because some people want a quick study, some people want moderate, and some people want to do a longer version of the exam test. So let's get to it.
Would you like free audiobooks? Click the link in the description. Question 1. A 55-year-old male patient presents with chest pain radiating to his left arm and jaw. His ECG shows ST segment elevation in leads 2, 3, and AVF. Which of the following interventions should the nurse prioritize? A. Administer morphine for pain relief. B. Prepare the patient for percutaneous coronary intervention, PCI. C. Give sublingual nitroglycerin. D. Administer a beta blocker. Answer. B. Prepare the patient for percutaneous coronary intervention, PCI. Rationale: the patient's presentation and ECG findings suggest an acute inferior wall myocardial infarction, MI. The priority intervention is to restore coronary blood flow, which is best achieved through PCI. While pain relief, morphine, vasodilation, nitroglycerin, and rate control, beta blocker, are important, they do not directly address the occluded coronary artery. Question 2. A patient with chronic kidney disease, CKD, has been admitted with severe hyperkalemia. The nurse prepares to administer which of the following medications to immediately lower serum potassium levels? A. Sodium polystyrene sulfonate, Ketoacidosis. B. Insulin and glucose. C. Spironolactone, aldactone. D. Lisinopril, Zestrol. Answer. B. Insulin and glucose. Rationale: insulin, when administered with glucose, facilitates the uptake of potassium into cells, rapidly lowering serum potassium levels. Sodium polystyrene sulfonate works more slowly by removing potassium through the gastrointestinal tract. Spironolactone and lisinopril can increase potassium levels and are not appropriate in this acute setting. Question 3. A 45-year-old female with a history of systemic lupus erythematosus, SLE, presents with new onset of hematuria and proteinuria. What diagnostic test should the nurse anticipate to determine the extent of renal involvement? A. Serum creatinine. B. Urinalysis. C. Renal ultrasound. D. Kidney biopsy. Answer. D. Kidney biopsy. Rationale: while serum creatinine and urinalysis provide useful information about kidney function, a kidney biopsy is definitive for diagnosing the extent of renal involvement and guiding treatment in patients with lupus nephritis. Question 4. A patient with liver cirrhosis is experiencing increasing confusion and hysterexis. The nurse recognizes these symptoms as indicative of A. Hepatic encephalopathy. B. Portal hypertension. C. Ascites. D. Hepatorenal syndrome. Answer. A. Hepatic encephalopathy. Rationale: hepatic encephalopathy results from the liver's inability to detoxify substances in the blood, leading to neuropsychiatric abnormalities such as confusion and hysterexis, flapping tremor. Portal hypertension, ascites, and hepatorenal syndrome are complications of cirrhosis, but do not directly cause these neurological symptoms. Question 5. A 60-year-old male patient with chronic obstructive pulmonary disease, COPD, is admitted with worsening dyspnea and respiratory acidosis. Which of the following interventions should the nurse prioritize? A. Encourage pursed lip breathing. B. Administer bronchodilators. C. Initiate non-invasive positive pressure ventilation, NIPPV. D. Provide low-flow oxygen therapy. Answer. C. Initiate non-invasive positive pressure ventilation, NIPPV. Rationale: NIPPV, such as BiPAP, can improve ventilation and correct respiratory acidosis by reducing the work of breathing and improving gas exchange. While bronchodilators and oxygen therapy are also important, NIPPV is the priority in severe exacerbations with respiratory acidosis. Question 6. A patient is postoperative day 2 following a total hip replacement and is exhibiting signs of hypovolemia. What assessment finding is most concerning to the nurse? A. Blood pressure of 100/60 mm of mercury. B. Heart rate of 120 beats per minute. C. Urine output of 20 milliliters per hour. D. Hematocrit of 35%. Answer: C. Urine output of 20 milliliters per hour. Rationale: oliguria, urine output less than 30 milliliters per hour, is a critical indicator of decreased renal perfusion and hypovolemia. While hypotension, tachycardia, and changes in hematocrit are concerning, urine output is a direct measure of kidney function and perfusion status. Question 7. A patient with a history of myocardial infarction presents with acute shortness of breath, pink frothy sputum, and crackles on auscultation. What is the most likely diagnosis? A. Pulmonary embolism. B. Acute respiratory distress syndrome, ARDS. C. Pneumonia. D. Acute pulmonary edema. Answer: D. Acute pulmonary edema. Rationale: the symptoms described are classic for acute pulmonary edema, particularly the pink frothy sputum and crackles. This condition often occurs secondary to left ventricular failure in the context of a myocardial infarction. Question 8. A patient with severe sepsis is being managed in the ICU. Which of the following parameters is the best indicator of tissue perfusion? A. Blood pressure. B. Central venous pressure, CVP. C. Urine output. D. Lactate levels. Answer: D. Lactate levels. Rationale: elevated lactate levels are a direct marker of anaerobic metabolism due to tissue hypoperfusion and are used to gauge the severity of sepsis and the effectiveness of resuscitation efforts. Blood pressure, CVP, and urine output are also important but less specific for tissue perfusion. Question 9. A patient with a known history of atrial fibrillation presents with sudden onset of left-sided weakness and aphasia. What is the nurse's priority action? A. Administer aspirin. B. Obtain a stat CT scan of the head. C. Prepare the patient for thrombolytic therapy. D. Perform a 12-lead ECG. Answer: B. Obtain a stat CT scan of the head. Rationale: the patient's symptoms suggest an acute stroke, likely ischemic given the history of atrial fibrillation. A CT scan is essential to confirm the diagnosis and rule out hemorrhage before considering thrombolytic therapy. Aspirin and ECG are important but not the immediate priority. Question 10. A patient with a history of type 1 diabetes mellitus is found unresponsive with a blood glucose level of 25 mg per deciliter. What is the nurse's immediate action? A. Administer IV dextrose. B. Start an insulin drip. C. Give an IM glucagon injection. D. Call for a rapid response team. Answer: A. Administer IV dextrose. Rationale: the immediate treatment for severe hypoglycemia, especially when the patient is unresponsive, is to administer IV dextrose to rapidly increase blood glucose levels. IM glucagon is an alternative if IV access is not available, but it is slower. Question 11. A 70-year-old female patient with a history of atrial fibrillation is on warfarin therapy. She presents with a nosebleed and INR of 6.0. Which of the following interventions should the nurse anticipate? A. Administering vitamin K. B. Increasing the dose of warfarin. C. Starting a heparin infusion. D. Providing fresh frozen plasma, FFP. Answer: A. Administering vitamin K. Rationale: an INR of 6.0 indicates a high risk of bleeding. Vitamin K is the antidote for warfarin toxicity and helps reverse the anticoagulation effect. Fresh frozen plasma may be used in severe cases, but vitamin K is the first-line treatment. Increasing the warfarin dose or starting heparin would exacerbate the problem. Question 12. A patient with a history of type 2 diabetes mellitus is admitted with a blood glucose level of 600 mg per deciliter, fruity-smelling breath, and deep, rapid respirations. What is the most likely diagnosis? A. Hypoglycemia. B. Diabetic ketoacidosis, DKA. C. Hyperosmolar hyperglycemic state, HHS. D. Lactic acidosis. Answer: B. Diabetic ketoacidosis, DKA. Rationale: the patient's hyperglycemia, fruity breath, and Kussmaul respirations, deep, rapid breathing, are indicative of DKA. HHS also presents with hyperglycemia but typically without ketoacidosis and Kussmaul respirations. Question 13. A patient with chronic heart failure is being treated with furosemide. The nurse should monitor for which electrolyte imbalance? A. Hyperkalemia. B. Hypercalcemia. C. Hypokalemia. D. Hypophosphatemia. Answer: C. Hypokalemia. Rationale: furosemide is a loop diuretic that can cause significant potassium loss, leading to hypokalemia. Monitoring potassium levels is crucial to prevent complications such as arrhythmias. Question 14. A 55-year-old male with a history of chronic obstructive pulmonary disease, COPD, is admitted with acute exacerbation. Which of the following lab results would the nurse expect to find? A. Decreased PaCO2. B. Increased PaO2. C. Increased bicarbonate, HCO3. D. Decreased hematocrit. Answer: C. Increased bicarbonate, HCO3. Rationale: chronic COPD patients often develop compensatory metabolic alkalosis with increased bicarbonate levels due to chronic respiratory acidosis. Decreased PaCO2 and increased PaO2 are not typical in COPD exacerbations, and hematocrit is not directly affected by COPD. Question 15. A patient with acute pancreatitis presents with severe abdominal pain radiating to the back and elevated serum amylase and lipase levels. Which intervention should the nurse prioritize? A. Initiating enteral feeding. B. Administering IV fluids. C. Providing a high-fat diet. D. Starting antibiotic therapy. Answer: B. Administering IV fluids. Rationale: fluid resuscitation is critical in acute pancreatitis to maintain hemodynamic stability and organ perfusion. Enteral feeding, high-fat diet, and antibiotics are not initial priorities and may be contraindicated in the acute phase. Question 16. A patient with a history of congestive heart failure presents with jugular venous distension, hepatomegaly, and peripheral edema. What is the most likely underlying cause of these symptoms? A. Left-sided heart failure. B. Right-sided heart failure. C. Pulmonary embolism. D. Myocardial infarction. Answer: B. Right-sided heart failure. Rationale: right-sided heart failure leads to systemic venous congestion, manifesting as jugular venous distension, hepatomegaly, and peripheral edema. Left-sided heart failure typically causes pulmonary congestion. Question 17. A 65-year-old male with a history of hypertension and smoking presents with sudden, severe back pain and a pulsatile abdominal mass. What is the most likely diagnosis? A. Acute pancreatitis. B. Abdominal aortic aneurysm, AAA, rupture. C. Renal colic. D. Gastroesophageal reflux disease, GERD. Answer. B. Abdominal aortic aneurysm, AAA, rupture. Rationale: a pulsatile abdominal mass with severe back pain is highly suggestive of an AAA rupture, a medical emergency requiring immediate surgical intervention. Acute pancreatitis, renal colic, and GERD do not present with a pulsatile mass. Question 18. A patient with suspected meningitis has a lumbar puncture performed. Which cerebrospinal fluid (CSF) finding would indicate bacterial meningitis? A. Low protein level. B. Normal glucose level. C. High white blood cell count with neutrophils. D. Presence of red blood cells. Answer. C. High white blood cell count with neutrophils. Rationale: bacterial meningitis is characterized by an elevated white blood cell count, particularly neutrophils, in the CSF. Elevated protein and low glucose levels are also typical, but the presence of neutrophils is most indicative of bacterial infection. Question 19. A patient with a history of alcohol abuse is admitted with confusion, ataxia, and ophthalmoplegia. The nurse suspects Wernicke's encephalopathy. Which vitamin deficiency is most likely responsible for these symptoms? A. Vitamin B12. B. Vitamin C. C. Vitamin D. D. Thiamine, vitamin B1. Answer. D. Thiamine, vitamin B1. Rationale: Wernicke's encephalopathy is caused by thiamine, vitamin B1, deficiency, commonly associated with chronic alcohol abuse. It presents with the classic triad of confusion, ataxia, and ophthalmoplegia. Question 20. A patient with chronic renal failure presents with pruritus, nausea, and a metallic taste in the mouth. What is the most likely cause of these symptoms? A. Hypocalcemia. B. Hyperkalemia. C. Uremia. D. Hyponatremia. Answer. C. Uremia. Rationale: uremia results from the accumulation of waste products in the blood due to renal failure and causes symptoms such as pruritus, nausea, and a metallic taste. Hypocalcemia, hyperkalemia, and hyponatremia can occur in renal failure but do not directly cause these symptoms. Question 21. A patient with a history of chronic liver disease is admitted with ascites and jaundice. The nurse understands that which laboratory result is most indicative of the severity of the patient's liver dysfunction? A. Serum albumin. B. Aspartate aminotransferase, AST. C. Bilirubin. D. Prothrombin time, PT. Answer. D. Prothrombin time, PT. Rationale: prothrombin time is a key indicator of liver function because the liver synthesizes clotting factors. Prolonged PT indicates significant liver dysfunction. Serum albumin and bilirubin are also important, but PT is more directly related to liver synthetic function. Question 22. A 50-year-old female patient with a history of rheumatoid arthritis is admitted with severe fatigue, pallor, and dyspnea on exertion. Lab results reveal a hemoglobin level of 8 grams per deciliter. What is the most likely cause of her anemia? A. Iron deficiency. B. Vitamin B12 deficiency. C. Chronic disease. D. Acute blood loss. Answer. C. Chronic disease. Rationale: anemia of chronic disease is common in patients with rheumatoid arthritis and other chronic inflammatory conditions. It typically presents with normocytic or microcytic anemia. Iron deficiency and vitamin B12 deficiency have specific lab findings, and there is no indication of acute blood loss. Question 23. A patient with acute kidney injury, AKI, is in the oliguric phase. What is the primary concern during this phase? A. Hypokalemia. B. Hypovolemia. C. Hyperkalemia. D. Hypercalcemia. Answer: C. Hyperkalemia. Rationale: during the oliguric phase of AKI, decreased urine output leads to the retention of potassium, causing hyperkalemia, which can be life-threatening. Hypokalemia and hypovolemia are less likely in this phase, and hypercalcemia is not a typical concern in AKI. Question 24. A patient with a history of deep vein thrombosis, DVT, is started on warfarin therapy. The nurse educates the patient on the importance of maintaining consistent dietary intake of which vitamin? A. Vitamin A. B. Vitamin D. C. Vitamin E. D. Vitamin K. Answer: D. Vitamin K. Rationale: warfarin's effectiveness is influenced by vitamin K intake, which can alter INR levels. Patients on warfarin should maintain a consistent intake of vitamin K to prevent fluctuations in anticoagulation. Question 25. A patient with acute bacterial pneumonia presents with fever, chills, productive cough, and pleuritic chest pain. Which of the following diagnostic tests should the nurse anticipate? A. Sputum culture and sensitivity. B. Electrocardiogram ECG. C. Pulmonary function tests, PFTs. D. Arterial blood gases, ABGs. Answer: A. Sputum culture and sensitivity. Rationale: sputum culture and sensitivity are crucial for identifying the causative organism and determining appropriate antibiotic therapy. ECG and ABGs are not diagnostic for pneumonia, and PFTs are more relevant for chronic respiratory conditions. Question 26. A 65-year-old male with a history of type 2 diabetes presents with a non-healing foot ulcer and signs of systemic infection. Which of the following interventions should the nurse prioritize? A. Administering insulin. B. Performing a wound culture. C. Starting broad-spectrum antibiotics. D. Applying a sterile dressing. Answer: C. Starting broad-spectrum antibiotics. Rationale: the presence of systemic infection signs indicates sepsis, necessitating prompt initiation of broad-spectrum antibiotics. A wound culture is important but should not delay antibiotic administration. Insulin and wound care are also necessary but secondary to managing the infection. Question 27. A patient with a history of gastroesophageal reflux disease, GERD, presents with difficulty swallowing and unintentional weight loss. The nurse is concerned about the development of which condition? A. Esophageal stricture. B. Barrett's esophagus. C. Esophageal cancer. D. Hiatal hernia. Answer: C. Esophageal cancer. Rationale: difficulty swallowing, dysphagia, and unintentional weight loss in a patient with GERD are concerning for esophageal cancer. Barrett's esophagus is a precursor to cancer, and strictures and hiatal hernias do not typically cause weight loss. Question 28. A patient with newly diagnosed hypertension is started on lisinopril. The nurse should monitor for which common side effect? A. Bradycardia. B. Persistent cough. C. Hyperglycemia. D. Hypokalemia. Answer: B. persistent cough. Rationale: lisinopril, an ACE inhibitor, commonly causes a persistent, dry cough due to the accumulation of bradykinin. Bradycardia is more associated with beta blockers, hyperglycemia with corticosteroids, and hypokalemia with diuretics. Question 29. A patient with multiple myeloma presents with bone pain and hypercalcemia. The nurse understands that hypercalcemia in this patient is due to A. Increased dietary calcium intake. B. Renal failure. C. Bone resorption. D. Parathyroid hormone, PTH, overproduction. Answer: C. Bone resorption. Rationale: in multiple myeloma, malignant plasma cells cause increased bone resorption, releasing calcium into the bloodstream and leading to hypercalcemia. Increased dietary intake, renal failure, and PTH overproduction are not the primary causes in this context. Question 30. A patient with acute stroke presents with right-sided weakness and difficulty speaking. The nurse should anticipate which diagnostic test to be performed first. A. Magnetic resonance imaging, MRI. B. Computed tomography, CT, scan. C. Electroencephalogram, EEG. D. Carotid ultrasound. Answer: B. Computed tomography, CT, scan. Rationale: a CT scan is the first diagnostic test performed in suspected acute stroke to differentiate between ischemic and hemorrhagic stroke, guiding subsequent treatment. MRI, EEG, and carotid ultrasound are useful, but not the immediate priority. Question 31. A 45-year-old female patient presents with a butterfly-shaped rash on her face, fatigue, and joint pain. The nurse suspects systemic lupus erythematosus, SLE. Which diagnostic test is most specific for SLE? A. Rheumatoid factor, RF. B. Erythrocyte sedimentation rate, ESR. C. Anti-double-stranded DNA, anti-dsDNA, antibody. D. Complete blood count, CBC. Answer: C. Anti-double-stranded DNA, anti-dsDNA, antibody. Rationale: the anti-dsDNA antibody is highly specific for SLE and helps confirm the diagnosis. RF is more specific to rheumatoid arthritis, ESR is a nonspecific marker of inflammation, and CBC is part of routine evaluation but not specific for SLE. Question 32. A patient with a history of myocardial infarction presents with a new systolic murmur and hypotension. The nurse suspects which complication? A. Aortic stenosis. B. Mitral valve prolapse. C. Papillary muscle rupture. D. Ventricular septal defect. Answer: C. Papillary muscle rupture. Rationale: papillary muscle rupture is a serious complication of myocardial infarction that can cause acute mitral regurgitation, leading to a new systolic murmur and hypotension. Aortic stenosis, mitral valve prolapse, and ventricular septal defect present differently. Question 33. A patient with a history of epilepsy presents with a prolonged seizure lasting more than 5 minutes. What is the priority nursing intervention? A. Administering lorazepam. B. Monitoring vital signs. C. Starting an IV line. D. Preparing for intubation. Answer: A. Administering lorazepam. Rationale: status epilepticus is a medical emergency. The priority is to stop the seizure activity, typically with benzodiazepines like lorazepam. Monitoring vital signs, starting an IV, and preparing for intubation are important but secondary to controlling the seizure. Question 34. A patient with rheumatoid arthritis is started on methotrexate therapy. The nurse should include which of the following in the patient's education? A. Take this medication with food to minimize gastrointestinal upset. B. Avoid alcohol to reduce the risk of liver damage. C. You may experience weight gain as a side effect. D. Increase your intake of vitamin C to enhance absorption. Answer. B. Avoid alcohol to reduce the risk of liver damage. Rationale: methotrexate can cause hepatotoxicity, and alcohol increases this risk. Patients should avoid alcohol to protect their liver. Taking with food, weight gain, and vitamin C intake are not directly relevant to methotrexate use. Question 35. A patient with chronic renal failure is on erythropoietin therapy. The nurse should monitor for which potential adverse effect: A. Hypotension. B. Hyperkalemia. C. Hypertension. D. Hypoglycemia. Answer. C. Hypertension. Rationale: erythropoietin therapy can increase red blood cell production, potentially leading to hypertension. Monitoring blood pressure is essential to manage this risk. Hypotension, hyperkalemia, and hypoglycemia are not typical side effects. Question 36. A patient with Guillain-Barré syndrome is experiencing respiratory muscle weakness. The nurse should prioritize which assessment: A. Peak expiratory flow rate. B. Arterial blood gases, ABGs. C. Pulse oximetry. D. Forced vital capacity, FVC. Answer. D. Forced vital capacity, FVC. Rationale: forced vital capacity is crucial for assessing respiratory muscle strength in Guillain-Barré syndrome. It helps determine the need for mechanical ventilation. Pulse oximetry and ABGs are also important, but FVC directly measures respiratory muscle function. Question 37. A patient with chronic obstructive pulmonary disease, COPD, is prescribed a long-acting beta agonist. The nurse should educate the patient about which potential side effect: A. Dry mouth. B. Tremors. C. Bradycardia. D. Constipation. Answer. B. Tremors. Rationale: long-acting beta agonists can cause side effects such as tremors and palpitations due to their sympathomimetic effects. Dry mouth, bradycardia, and constipation are not common side effects of beta agonists. Question 38. A 60-year-old male presents with weight loss, jaundice, and a palpable mass in the right upper quadrant. The nurse suspects which condition: A. Hepatitis. B. Cirrhosis. C. Pancreatic cancer. D. Cholecystitis. Answer. C. Pancreatic cancer. Rationale: weight loss, jaundice, and a palpable mass in the right upper quadrant are indicative of pancreatic cancer. Hepatitis and cirrhosis present with jaundice, but typically not with a palpable mass, and cholecystitis does not typically cause weight loss and jaundice together. Question 39. A patient with severe sepsis is receiving intravenous fluids and vasopressors. Which of the following is the best indicator of adequate tissue perfusion? A. Central venous pressure, CVP. B. Mean arterial pressure, MAP. C. Lactate levels. D. Urine output. Answer. C. Lactate levels. Rationale: lactate levels are a direct indicator of tissue perfusion and the presence of anaerobic metabolism. While CVP, MAP, and urine output are important parameters, lactate levels provide specific information about tissue oxygenation and perfusion. Question 40. A patient with chronic kidney disease, CKD, is on a potassium-restricted diet. The nurse should advise the patient to avoid which of the following foods: A. Apples. B. Bananas. C. Grapes. D. Strawberries. Answer B. Bananas. Rationale: bananas are high in potassium and should be avoided by patients on a potassium-restricted diet. Apples, grapes, and strawberries are lower in potassium and are safer options. Question 41. A 50-year-old male with a history of hypertension presents with a sudden, severe headache and visual disturbances. The nurse is concerned about which condition? A. Migraine headache. B. Cluster headache. C. Intracranial hemorrhage. D. Tension headache. Answer C. Intracranial hemorrhage. Rationale: a sudden, severe headache with visual disturbances in a hypertensive patient raises concern for an intracranial hemorrhage, which is a medical emergency. Migraines and cluster headaches are less likely given the acute and severe presentation, and tension headaches do not typically cause visual disturbances. Question 42. A patient with acute respiratory distress syndrome, ARDS, is on mechanical ventilation. The nurse should prioritize which assessment to evaluate the effectiveness of ventilation? A. Arterial blood gases, ABGs. B. Peak inspiratory pressure. C. Chest X-ray. D. Pulse oximetry. Answer A. Arterial blood gases, ABGs. Rationale: ABGs provide direct information about the patient's gas exchange and the effectiveness of ventilation. Peak inspiratory pressure, chest X-ray, and pulse oximetry are useful, but ABGs are the most comprehensive assessment. Question 43. A patient with newly diagnosed hypothyroidism is started on levothyroxine. The nurse should monitor for which potential adverse effect during the initial phase of treatment? A. Hypotension. B. Bradycardia. C. Hyperthyroidism. D. Hyperkalemia. Answer C. Hyperthyroidism. Rationale: overreplacement of thyroid hormone can lead to symptoms of hyperthyroidism, such as tachycardia, nervousness, and weight loss. Monitoring for these symptoms is crucial to adjusting the dosage appropriately. Hypotension, bradycardia, and hyperkalemia are not typical concerns. Question 44. A patient with a history of atrial fibrillation is scheduled for electrical cardioversion. The nurse should ensure which of the following before the procedure? A. The patient has been NPO for at least 6 hours. B. The patient has received anticoagulation therapy. C. The patient's blood pressure is above 140/90 mm of mercury. D. The patient is in a supine position. Answer B. The patient has received anticoagulation therapy. Rationale: anticoagulation therapy is essential before cardioversion to reduce the risk of thromboembolism. Ensuring the patient is NPO, monitoring blood pressure, and positioning are important but secondary to anticoagulation status. Question 45. A patient with acute lymphoblastic leukemia, ALL, is undergoing chemotherapy and develops fever and neutropenia. What is the nurse's priority action? A. Administering antipyretics. B. Starting broad-spectrum antibiotics. C. Isolating the patient. D. Obtaining a complete blood count, CBC. Answer B. Starting broad-spectrum antibiotics. Rationale: fever and neutropenia in a patient undergoing chemotherapy are indicative of a possible infection, which can be life-threatening. Prompt initiation of broad-spectrum antibiotics is crucial. Antipyretics, isolation, and CBC are important but secondary to antibiotic administration. Question 46. A patient with a history of chronic obstructive pulmonary disease, COPD, presents with increasing dyspnea and a barrel-shaped chest. The nurse understands that the barrel chest is due to A. Chronic hyperinflation of the lungs. B. Chronic bronchoconstriction. C. Increased mucus production. D. Recurrent respiratory infections. Answer: A. Chronic hyperinflation of the lungs. Rationale: chronic hyperinflation of the lungs in COPD leads to a barrel-shaped chest. This is a structural change due to the prolonged expansion of the lungs and thoracic cage. Bronchoconstriction, mucus production, and infections contribute to COPD symptoms but do not cause barrel chest. Question 47. A patient with suspected acute pancreatitis presents with elevated serum amylase and lipase levels. Which imaging study is most appropriate to confirm the diagnosis? A. Abdominal X-ray. B. Computed tomography, CT, scan. C. Magnetic resonance imaging, MRI. D. Ultrasound. Answer: B. Computed tomography, CT, scan. Rationale: a CT scan is the preferred imaging study to confirm acute pancreatitis, as it provides detailed images of the pancreas and can identify complications such as necrosis or abscess. Abdominal X-ray, MRI, and ultrasound are less specific. Question 48. A patient with chronic liver disease presents with confusion, asterixis, and elevated ammonia levels. The nurse anticipates administering which of the following medications? A. Lactulose. B. Spironolactone. C. Furosemide. D. Propranolol. Answer: A. Lactulose. Rationale: lactulose is used to reduce blood ammonia levels by promoting its excretion through the gastrointestinal tract. This is crucial in managing hepatic encephalopathy. Spironolactone, furosemide, and propranolol are used for other complications of liver disease. Question 49. A patient with a history of heart failure presents with acute onset of shortness of breath, orthopnea, and pink frothy sputum. What is the nurse's priority intervention? A. Administering IV furosemide. B. Placing the patient in a supine position. C. Giving sublingual nitroglycerin. D. Starting a beta blocker. Answer: A. Administering IV furosemide. Rationale: the patient's symptoms suggest acute pulmonary edema, a severe complication of heart failure. IV furosemide is the priority to reduce fluid overload and alleviate symptoms. Positioning the patient upright, administering nitroglycerin, and beta blockers are also important but secondary. Question 50. A 65-year-old male with chronic kidney disease, CKD, is experiencing severe itching. The nurse understands that the itching is most likely due to A. Hyperkalemia. B. Hyperphosphatemia. C. Hypercalcemia. D. Hyponatremia. Answer: B. Hyperphosphatemia. Rationale: severe itching in CKD patients is often due to hyperphosphatemia, which can lead to calcium phosphate deposits in the skin. Managing phosphate levels is essential to alleviate this symptom. Hyperkalemia, hypercalcemia, and hyponatremia do not typically cause itching.